My name is Dr. Geoffrey Mutuma. I come from the Zabes Hostel, which is in South Sea, in Mayo Road, and we are normally focused on treatment of cancers. We normally focus on awareness of cancers and also focus on diagnosis of cancers. And mainly today, we are not talking about cancer. I would like to talk about abdominal pain. And last time, or the other video, there's that video which I talked about upper abdomen, or what we call peptic ulcer disease. Today, I want to focus in other parts of the abdomen. I've said that the abdomen is designed of mainly 5 parts. There is the upper part, which is a major one, which I discussed in a separate video. And today I want to talk about the middle part that's around the umbilicus. I need to talk about the left side of the stomach and of the abdomen, and the right side of the abdomen, and the middle part of the abdomen. And this I'll be able to cover it, and so that I show you the difference of when you have abdominal pain. Because most of us, the doctors, when a patient, the way I've said is that when the doctor says that I've got abdominal pain, you don't know exactly where that pain is, and of course that we examine now. I'll talk about the middle part of the abdomen, that's around the umbilicus. Normally, when somebody has got middle part of the umbilicus, normally sometimes it's painful, sometimes not painful, and in most cases in that area, when you have got those diseases, is mainly brucella or typhoid. You have got pain mainly in the middle of the stomach, that's around the umbilicus. And sometimes when somebody has got typhoid or brucella, you find that actually we don't know exactly which disease it is, but those are the major diseases which brings pain in the middle of the stomach or the middle of the abdomen. Is that we have to take a test, and we are able to test and check what's happening with this person. Does he have a brucella and typhoid? Brucella and typhoid are not that common nowadays. They used to be common before, but nowadays, typhoid and brucella are not that common. And of course, as brucella is common in some few areas, like in Masai land, it's very common. Typhoid is somewhat common in everywhere. And that's that when you got those diseases, you can't know which one it is, because presentation is the same. What patient feels is the same. You've got a pain around the umbilical cord, and then the pain sometimes is there, sometimes not there. You've got a backache, which might. Sometimes you've got constipation, especially when you've got typhoid. You've got more constipation, and you've got hard stool, and you've got a bit of headache. And the same thing with brucella. And the only way you can be able to diagnose those diseases is actually by doing blood tests, which are quite common nowadays. That's why sometimes when you got pain there around the umbilicus, you can't go and treat somebody right away. You need to do some bit of tests and to know which is actually the disease. And one, we know that somebody has got the disease because very easy to be treated, and normally give antibiotics, and disease is cleared. Remember, there are people with so many of those diseases, and they stay with those diseases for a long, long time, because they are not that painful, they are not that sick, and they don't stay sick for medical advice. Of course, there are some people who have got typhoid, and within very short time, those who are sick, and they become bedridden very fast. And some people actually pass on because of typhoid. So typhoid is a serious disease, but it's not that serious, and some people can survive with it for quite a long time, which becomes chronic enteritis. And you have got stomach pain for a long time until you are given a treatment, you still remain that disease for a long time. Now, that's the middle of the stomach, the middle of the abdomen, because stomach is very different, the middle of the abdomen. And now I'm to talk about the left side of the abdomen, which is mainly where the colon is, the left side. You can have the pain in upper part, in middle part, on the left side. That's colon, and mainly this common when you got diarrhea and amoeba, and you find that the left side of the abdomen is where the colon is, and that's when we got something like colitis. And when you got something colitis, either acute colitis or chronic colitis means that you have got a pain in the left side of the stomach. Sometimes it's so acute and you feel a lot of colic pain, and then you go and have diarrhea. Sometimes the diarrhea can be quite devastating. Sometimes you can have diarrhea, or you can also have blood diarrhea, and that's quite serious, because mainly this is because of amoeba. And I'm sure most of our viewers, most of our listeners today, is that when you've got amoeba, and if people have got amoeba, you've got very acute diarrhea, a lot of diarrhea, and this comes because of amoeba. And that's why when you've got pain in the left side of the abdomen, we always think about amoeba, which is quite common disease nowadays. And of course, amoeba is oral, and that's why it normally transmits through food. And that's why when you have it, it's good to be treated, because unless you are treated, you continue having problems, because amoeba is a chronic infection which can cause a lot of problems, especially to adults. In children, it's not that serious, but amoeba is more common in children. And normally you have pain in the left and left side of the abdomen. And apart from colitis, which is quite common, we have got other disease in the left side of the abdomen. But today, I would like to cover about amoeba because that's a common disease which you have. Now, let me cover the middle part of the abdomen, and that is above the pelvic region. They can have pain there, and that pain can be different. There's men, they can have pain there. Women can have pain there, and when women have got pain in the lower part, the middle or lower part of the abdomen, the bottom part of the abdomen, is just because of something called PID. Is pelvic inflammatory disease, which is quite common in women, especially for young women, and this is quite serious in women because when you've got a problem there, is you need to be checked because this is what causes infertility in women. Because when women have got a lot of PID and got infection, bacterial infection around the fallopian tubes, those tubes become blocked, and that's why you find that some women cannot get children because when they were young, they had PID or infection, they had pain there, which sometimes it can be a lot, sometimes can be low, but mainly when people have got pain there, they normally have issues on infertility later in life. In men, when there's pain in the middle part of the pelvic region, is because something called cystitis or something called UTI, urinary tract infection, which can both affect men and women, and also they can have a problem there because of issues of the prostate. So when men have got pain there is different from what women have got pain there because the causes of pain there for men and women is quite different. And that's why when somebody says has got pain in the abdomen, has got pain in the lower part of the abdomen, it's always good, very good to first check it, and second to do some tests. And the first test we do, we check the urine, and the other test which we do the ultrasound to check if the blood is okay, if the tubes are okay, if the ovaries are okay, and if there's any infection around there, and also if the prostate is okay for men. And that's why, and also for women, we check if you've got fibroids, which can also cause pain, but mainly fibroids that do not cause any abdominal pain because it's just growth or distension of the abdomen because fibroid can be very big, apart from other signs and symptoms which they may have. Now, the right side of the abdomen is that actually that's mainly where the appendix is, and that's why when people have got pain there, mainly they've got appendicitis. Appendicitis can be acute appendicitis or chronic appendicitis, depending how long the infection of the appendix has remained. And that's when somebody has got pain in the right side of the abdomen, we normally focus on appendix, and sometimes we'll be able to check and most of the time we just go ahead and remove the appendix because that's what's causing a problem, what we call appendicectomy. And that's a difference. Now I've covered the abdomen and abdominal complaints. I've covered in the other slide. I covered about the upper abdomen because of the stomach itself, the middle abdomen because of typhoid and brucella, the right side of the abdomen because of appendicitis, and the left side because of colitis or the problem of colon. So that's actually the whole of the stomach, and I'm sure that you have benefited a lot. And in case of these issues, you can always visit us. You can always be able to call me. You can go to visit us in the hospital. You can be able to see what it is, because what we have seen and what we have discovered is that we have got so many people who have got problem of the abdomen, problem of the stomach, and they stay with it for a long time, and people can be quite have a real problem, especially those who have got pelvic cancers and they start reducing weight, or you've got amoeba, or even intestinal worms, and which are not very common nowadays because before they were there. So my name is Dr. Geoffrey Mutuma from the best hospital in South Sea. If you want to get in touch with me, my number is 0722-801-299. That's my Safaricom, and the Airtel number is 0734-801-299. Thank you very much for listening, and always, if you want to get us through our YouTube channel or through our social media, please get us, and you can always ask us a questions which will be benefit for you or your family or your friends, because we know what happening is that we have got a lot of disease nowadays in the medical field, and of course most of us doctors, you have no time to sit down and explain all this when you come to consult us. Of course, you consult and we focus mainly on the disease you come to consult us about. And because of, I don't know, because of numbers, because of what, we don't have a lot of time to be able to explain to you. But I'm sure through this, you can listen, you can benefit a lot from this, and you can also be able to learn something that can be important for you. And of course, I've given my number. In case you've got any question, you can always call me. I'll be able to answer a question. And of course, you can always visit us if in case you want any treatment or to be checked. And that's the way it is that we do screening for cancers. And the screening which we can do either in your place, we call it workplace health promotion. We come to your place and do cancer screening there. We can also come to your family, especially when you're having a family meeting. We check your blood pressure, we check your blood sugar, we check your weight, and we check few cancers. So that at least we are healthy, because health is your wealth. And unless you take care of your health, if your health becomes bad, it will take care of your wealth. That's your find that prevention is always better than cure. And that's why these sections, these videos which you give, is to make sure that at least you take care of your health, so that at least you don't get sick and you don't stay for long time with disease. You can go to hospital early enough. You're going to be able to prevent most of the diseases, because they are easily preventable and they can be easily be controlled, other than waiting until you come down because of disease, which are becoming quite common nowadays. So anytime you can get in touch with us. I've given my number, and you can always visit our YouTube or our social media platforms, so that we can be able to advise you what you need to do as a person, or even as a family, or even as a group. Especially in the churches, we do a lot of talks, a lot of screening in the churches, because that's the only way we can be able to make sure that at least people who are sick, they know about their health early enough. They can be able to take care of it. Asante sana. Thank you very much, and continue watching us in our social media. Asante sana.